start by welcoming everybody to this next session at NTW 23, and where I'm very pleased to welcome Sarah Whittley, a clinical trial manager within the Department of Surgery and Cancer at Imperial College London. Sarah has worked in various therapeutic areas, but is currently managing the NIHR-funded multi-centre assessor-blind randomised controlled trial THRomboprophylaxis in individuals undergoing superficial endovenous intervention, or THRIVE, a trial that will be extremely informative and helpful to clinicians and patients alike. And this afternoon, Sarah's here to talk about this, and the opportunity is to welcome clinicians to become involved. So over to you, please, Sarah.
That's great. Thanks, Jo. So I'm pleased to present to you today the THRIVE trial, which the NIHR has recently provided confirmation of funding for earlier this year. So I just have a brief slide set summarising the THRIVE trial, and we'll just give an update on where we're at in terms of the timelines. And then if anybody has any questions or would be interested in supporting the study, I'd be very happy to provide some further information at the end. So just a bit of background to the study then. Varicose veins are common, and they currently affect up to 45% of the UK population. So NICE guidelines recommend endovenous surgery as first choice management of symptomatic varicose veins. And endovenous surgery also has a level 1 recommendation in the ESVS clinical practice guidelines. Therefore, approximately 26 to 30,000 procedures are undertaken annually within the NHS, and an estimated 30 to 40,000 procedures are undertaken annually in the private sector. However, VTE is a known complication of endovenous treatment, and it occurs at a rate of up to 3.4%. And so in an attempt to reduce this risk of VTE, around 63% of practitioners in the UK and around 73% of practitioners in Ireland will prescribe pharmacological thromboprophylaxis for varicose vein procedures. However, despite 2/3 of practitioners prescribing pharmacological thromboprophylaxis to patients undergoing endovenous treatment, there's currently no high-quality evidence to support this practice. International and national guidelines also reflect the paucity of evidence in this area. So the ESVS guidelines recommend thromboprophylaxis strategies, whilst NICE guidelines advise that prophylaxis is generally not needed for people undergoing varicose vein surgery. And finally, a recent systematic review did find that there's a significant reduction in the rate of DVT with additional pharmacological thromboprophylaxis. And so routine prescription of anticoagulation following endovenous intervention should be considered. And so pharmacological thromboprophylaxis could have clinical and cost benefit in preventing VTE. However, grade A evidence is required to either support or refute this practice. And therefore, the aims of the THRIVE trial are to establish whether a single dose or an extended course of pharmacological thromboprophylaxis decrease the risk of VTE, whether pharmacological thromboprophylaxis is associated with increased bleeding, and whether or not it's cost effective. So the THRIVE trial is a multi-centre, assessor-blind, randomised controlled trial, and we hope that at least 40 NHS and private sites across the UK will take part in the study, and a total of 6,660 participants will be randomised to one of 3 arms, and these arms are compression therapy alone, a single dose of low molecular weight heparin, or an extended course of prophylaxis, either with a low molecular weight heparin or a DOAC. In terms of the IMPs, which have been included in the protocol, these have been defined based on the most commonly prescribed thromboprophylaxis regimens. So these, the low molecular weight heparin can either be dalteparin, tinzaparin, or enoxaparin, and the DOACs which can be prescribed include rivaroxaban, apixaban, and dabigatran, and these will be prescribed and administered as per standard practice. The primary outcome of the study is imaging confirmed lower limb DVT with or without symptoms, or PE with symptoms within 90 days of treatment. And the secondary outcomes include quality of life, mortality, and cost effectiveness of providing pharmacological thromboprophylaxis. Safety outcomes then include any bleeding event. In terms of the eligibility criteria, patients will be eligible if they are adults scheduled to undergo endovenous intervention under local anaesthetic, and treatment technologies include radiofrequency, laser, mechanochemical, sclerotherapy, and cyanoacrylates. And patients will be excluded if they have any clinical indication for therapeutic anticoagulation, if anticoagulation is contraindicated, if they have thrombophilia or a positive pregnancy test. And this is just the study flow chart outlining that patients will be screened, consented, and randomized at site prior to the procedure taking place. And then after the procedure has taken place, patients will then undergo a lower limb venous duplex scan at 21 to 28 days post-procedure to check for any asymptomatic lower limb DVT. And in terms of data collection, consent can be obtained either in writing or electronically, and participants will also be contacted centrally by the team at Imperial College at 7 days and 90 days post-procedure. And this will be done either by telephone, online, or SMS. And in terms of what sites will receive, sites will be reimbursed £145 for each patient who is randomised, and sites will also receive training on all protocol-related activities. And we're also in the process of registering this study on the Associate PI scheme. So Associate PIs will be allowed at the NIHR's discretion. So just an update then on the study timelines and where we're at the moment. We received confirmation of funding from the NIHR earlier this year, and the study was then later submitted to REC and MHRA in February, and it's currently being reviewed by the REC and MHRA. So once we've received feedback from REC and MHRA, we hope to have regulatory approvals in place by the end of June this year, after which we will perform SIVs and complete site setup ahead of recruitment, hopefully commencing in September this year. So if you are interested in participating in the study, or if you have any queries about the study, please do feel free to reach out to us, and you can contact either me directly or you can contact the Thrive Trial inbox. And the chief investigator for the study is Professor Davies, and the co-chief investigator is Mr. Daniel Carradise, and their email addresses have also been listed here in this slide for your reference if you would like to reach out to either of them as well. And that's everything from me. Thanks very much everyone for listening. I'm happy to answer any questions that anybody might have.
Thank you, Sarah. That was really clear and helpful. And I can see some comments. Somebody's asked, could you explain the Caprini score?
Yes, so the Caprini score, it's a Department of Health risk assessment tool, which is actually predominantly conducted in the EU, I believe, or in the US. So at the moment, the Department of Health risk assessment tool is what would be conducted in America, or sorry, in the UK. And we just want the Caprini score to also be taken in this study so that we can compare that to the Caprini score and the Department of Health risk assessment tool. So it's just a VTE risk assessment tool that we'd like to collect the information from.
Another query is, do you know how long is the study planning for extended thromboprophylaxis in the third arm?
So for the third arm, so the extended prophylaxis, it will depend on what the trust's treatment allocation is. So normally it would be 7, 10 or 14 days. We haven't stipulated a specific duration in the protocol just because we wanted to kind of be as flexible as possible. So it will be dependent on what your trust's standard practice is, but it's generally 7 days, 10 days or 14 days.
Okay, thank you very much. Now, you've put up email addresses there. By the way, they've said thank you for the answers to that. Thank you. But each day you're very kindly sharing information that we will send out in the e-shot. So really welcoming people to get in contact to see if there's any other local sites that can support or they work with as well, but to email with you to become part of this project. Is there anything that would be helpful if they shared at the beginning?
Not necessarily, just if you are interested, you can just email me and we'll take it from there. There's no sort of formal expression of interest form. It might be helpful if you could just maybe give a rough estimate of how many varicose vein procedures are being conducted in your trust at the moment, and how many patients you envisage being able to recruit between now and the end of recruitment, which is November 2025. But if you don't have that information to hand, then that's fine. You can still just you can reach out to us, and we can explore that information later on.
Thank you. Is there any minimum number that you require?
There's no minimum number, no. It will just depend on what sites. If sites are able to recruit, we'd be happy to take them on board.
Okay, that sounds really helpful. Thank you very much. If you do have any questions for Sarah, please do either email straight to me, or via the lounge, there's an email faculty, and just put in either Sarah's name or the topic Thrive, and I will forward those questions on. And as I've said, we will share each day this week, and then we'll get it up into the platform, some information about Thrive. So if you'd like to share it, think about it, discuss it with colleagues, please do. And then please do get in contact with Sarah and her team, because this is a really valuable project that would be so helpful, but needs everybody's involvement to get the numbers in and make it as great as it needs to be. So thank you. I think that's on the question front, but Sarah, thank you so much. And I look forward to hearing more as this study continues. So thank you.
Thank you very much. Thanks, Jo, for letting us present, and thanks everyone for listening. Feel free to reach out, and I look forward to hearing from anybody.